Let's talk about some of the key differences between casualty evacuation, also known as Casevac, and medical evacuation or MEDEVAC. The Merriam-Webster dictionary describes casualty as a military person lost through death, wounds, injury, sickness, internment or capture, or through being missing in action, or a person or thing injured, lost or destroyed. The United Nations define casualty as those suffering a trauma injury or those with sudden onset, acute, life-threatening condition requiring immediate expert medical intervention. Our definition is not limited to uniformed personnel, to trauma injuries, or to action-related injuries. Now, let's review the several differences between the two processes. A Casevac is an evacuation from the point of injury or the point of illness. This point can be any place, even a medical facility. It is also a continuum of care that supports a resuscitative process from the point of illness through evacuation into surgery and onto intensive care, where this is required. Several steps may be necessary with multiple transfers that still lie under the Casevac process. It relies on the most effective means of transportation. A MEDEVAC always starts from a medical treatment facility located in the duty station or the mission where the patient is appointed. It may use many different means of transportation, depending on the situation, such as commercial flights, contractual assets, or mission assets. One of the most important differences is that the two mechanisms do not concern the same scope of patients. A Casevac can be set for any casualty or patient who needs an immediate life, limb, or eye-saving medical intervention. It's a component of the damage control strategy. A MEDEVAC only applies to eligible patients who present an acute illness or injury. Its purpose is to provide essential medical care or treatment that cannot be secured locally because of inadequate medical facilities. A MEDEVAC is a step of the care journey. Casevac falls under the Rule 109 of the International Committee of the Red Cross Customary International Humanitarian Law. It states that whenever circumstances permit, and particularly after an engagement, each party to the conflict must, without delay, take all possible measures to search for, collect, and evacuate the wounded, sick, and shipwrecked without adverse distinction. For IHL, Casevac is not only about evacuation, but also search for casualties. Both civilians and attackers must also be evacuated through the Casevac process. For MEDEVAC, there is no international law framing its process. The administrative instruction lists the eligible patients. There are international recruited staff members, eligible family members such as a spouse, and recognized dependent children, troops, and UN personnel like UN police or military observers. The UN can define its own rules. Finally, let's explore the differences between the two procedures. Anyone on scene can request a Casevac, and it should not be a medical decision. Also, you do not need to have a medical background to request a Casevac. Time is a critical aspect of a Casevac, which is an operation with a life, limb, or eye-saving component. This means that the execution must sit at the lowest level to ensure the fastest possible process. The request is sent to a designated operations center, and the message is mostly operational. A designated operations officer has the authority to launch a Casevac in consultation with the designated operations officer if an air evacuation is required. A medical advice is only recommended, not mandatory. A MEDEVAC, on the other hand, is always requested by a physician. It's sent to and approved by the head of department office or by the director or chief of mission support and missions. The principle is the delegation of authority. A medical advice is mandatory, except in life-threatening situations. The medical services at the UN headquarters can even be consulted for some cases. A MEDEVAC is a medical decision, a medical transfer, and it requires travel medical documents. It may include an operational dimension, but only a physician can request it.